There's so much you can do to actually treat this conservatively and actually avoid surgery. Again, obviously it depends on firstly what's causing your hip pain, and if you do have arthritis and things, the degree of the arthritis, and that will all impact the prognosis that we give you about whether or not this is something we can manage conservatively. But the majority of hip pain we can treat with rehabilitation exercises and strengthening exercises and stretching exercises, and it responds really, really, really well to conservative care. So often it requires a process of trying to, if we need to increase the mobility of the tissues around the hip, then we try and do some stretching of those, try and open them up. Often, because a lot of hip pain, particularly in sedentary cultures, are from sitting in a chair, what that does is it compresses your hip joint. So a lot of the treatment modalities that we use are designed to try and decompress that a little bit so that there's a bit more space. A lot of the pain people get from sitting is because this hip, which is a ball and socket joint, is essentially compressing against itself. And what we're trying to do is lengthen that and open that up for them. So often we give them stretching exercises to do, and then we give them strengthening exercises to do as well, because it is a ball and socket. It's got a lot of range of motion, but there's also a lot of room for error, and we need everything working well together so that when you're moving your hip joint, it stays in its nice position here, and it's not going to abut against the rim of the hip joint, which is what causes a lot of that clickiness that people complain about. So stretching, strengthening, often we'll do hands-on work with them. So I'll actually be there. Sometimes I have this special seatbelt that I use sometimes, and I tie it around myself and I tie it around their hip. And the whole idea is we're opening this hip up, and patients say it feels amazing because it's just tractioning all this and taking all the pressure off. Sometimes we're lengthening their legs. Sometimes we're doing massage. In my practice, I think it's slightly different in the States with the licensing and thing, but I do a whole bunch of things. So I do Western acupuncture, also known as dry needling. And so we'll actually put needles in and around the hip to release it that way. Massage. Sometimes we'll do manipulations or adjustments either to the hip itself to open that up, or to the pelvis or the low back to try and get that moving. Sometimes to the knee, sometimes to the foot, because sometimes it's the foot that's really locked up from a functional point of view, then causing a hip strain in the hip or the hip to overwork. But even if you can't get in to see someone to do hands-on work, having a very specific tailored rehab plan is so effective for improving a lot of this hip pain. I treat the whole demographics of hip pain, from Olympic lifters lifting, 200 plus kilograms, to ultramarathon runners, to the grandma of my ultramarathon runners patients who just have more of a degenerative condition. And the majority of them do really, really well with just stretching and strengthening and targeting very specifically the muscles that we need to try and get some relief for them. If that doesn't work, then the next thing we often do, depending on the condition, is we might refer them for, often it will start with something like a cortisone injection, which is a really powerful anti-inflammatory. And that can often break that pain cycle enough so that people can then go on with their rehab exercises with a bit more comfort and actually be able to strengthen it. The cortisone injection is a very powerful anti-inflammatory, so it doesn't actually address the root cause of the issue. So it doesn't get people out of doing their homework, unfortunately, but it does just take some of that inflammation away to make it a bit more comfortable so that they can start walking again, or that they can do their exercises and things and then begin to strengthen it up. If nothing's working, then often we send them for surgery. And that's generally, we will have had an image by that point. MRI is generally the gold standard. We do x-rays or CT, but often it's MRI. And then I will refer them on to a hip specialist, and we'll see if we need to go in there and do a partial hip replacement, a full hip replacement, even just to clean up. If sometimes you can get bits of debris floating in the actual hip joint, and sometimes I'll just go in and clean that up. So that's kind of last case resort. As much as we can, we want to keep people away from surgery and away from drugs. That's my personal philosophy, because I think there's risks with every medical intervention, and the less invasive we have to do, the better in the long run for things. And also, with the strengthening and the stretching, you're actually addressing the root cause of the issue a lot of the time. And that actually is what sets people up long-term for better results. Bearing in mind, even if you do have to go in for surgery, we do know that if you go into surgery and you're nice and strong and you've been doing your rehab, you do get a better outcome as well. So that's why very often, even if we've been doing the rehab for a number of weeks and they're not getting better and we send them to surgery, we keep seeing them up until surgery, so that we can continue to strengthen as much as we can, because it does improve the outcomes of the surgery as well.